Thank you very much, Leslie, for hosting that panel and passing it over to me. Now that you've spent 35 minutes solving the climate crisis, it's our turn to solve the pandemic. My name is Peter Spiegel. I'm the U.S. Managing Editor of the Financial Times, and thank you for joining us to talk about the pandemic ahead of UNGA. UNGA is meeting at a rather pivotal time in the pandemic. We in the developed world is frankly awash in vaccines, and slightly unexpectedly are dealing with conspiracy theories and anti-vax movements in several developed countries, and yet the developing world is still scrambling to vaccinate its populations, leading to some real conflicts on the international level. As Ed said in his introductory remarks, sometimes it feels that a pandemic should have brought us all together, but actually created new forms of nationalism and conflict. What can we do to overcome that, and are there solutions to that? I have a distinguished panel to discuss that. Let me quickly introduce them. The speaker bios are linked there on your website for longer versions, but I will give quick highlights, and I'll start with Alaa Murabit, who is, gosh, again, has a very long list of honors in international security and health and in women's rights, but right now is the UN High-Level Commissioner for Health, Employment, and Economic Growth. Again, too many accolades and things to cite, but a couple that stood out to me. Most recently, won a distinguished fellowship, the Harvard Radcliffe Fellowship. It has also been leading the Gates Foundation Global Policy and Advocacy Health work, both very central to the current debate. The distinguished John Nkengasong, who is director of the African CDC, which is an agency as part of the AU Commission. Also, since the start of the outbreak, has been one of the WHO Director General's special envoys on COVID preparation. Again, right at the front lines of dealing with the pandemic. As an American who spent quite a bit of time in Belgium, also, I just want to pull out two things. Again, Dr. Nkengasong spent a lot of time here in Atlanta, in the US, at the US CDC, where he's also an adjunct professor at Emory, and near and dear to my heart, did most of his training in medicine in Brussels, Belgium, where my daughter was born. So that's a very, very important part of his bio. And lastly, we have Dr. Devi Sridhar, who is joining us from Scotland, where she's a professor at the University of Edinburgh Medical School, where my grandfather did his training almost a century ago. She's also founding director of the Global Health Governance Program and is a former Rhodes Scholar at Oxford, although did her undergraduate and doctorate work at the University of Miami here in the good old US of A. Let's start with the issue that I raised at the beginning, which is this odd place we're in right now, where the developed world is, if not fully vaccinated, at least coming to a point where everyone who wants a vaccine can get it, and the debate has become boosters, slightly embarrassingly, at a time when the developing world is still struggling. Dr. Nkengasong, you have been sort of at the forefront of this. I wonder if I could start with you and talk a bit about policy prescriptions here, because we've had, obviously, WHO had the COVAX program, where the developed world was supposed to be donating vaccines so that this would not happen. There's been a big debate on the international level about whether intellectual property rights are hindering development in the developing world and whether those need to be waived. Give us a snapshot of where you think we are right now in that debate, and whether you have particularly policy prescriptions that you would recommend to get us out of this place.
Thank you, Peter, for including me as part of this very distinguished panel. I don't know that I have a policy description, but if I had one, it would read like this. I would be saying, let's reset multilateralism. It has not promised, it has not lived on its promise. We need a reset button on how we govern ourselves to resolve bigger humanitarian crisis like the pandemic that we are currently facing. This is the greatest challenge of our time, and our behaviors have fallen short of the spirit and the underpinning of multilateralism, which we this week and next week, when I mean we, the collective, we as part of the United Nations, will be celebrating. One of the key functions of why we all came together, our forefathers came together in the 40s and created the United Nations, was to come together in times of crisis like this to find solutions that will be benefiting for everybody. The science that we all believe in has been incredibly generous for all of us in finding solutions for this pandemic. I would never have imagined that in 12 months, a vaccine for COVID will be identified, go through all the phases of clinical trials and get into the human arms. So let's pause and celebrate that. However, what is really appalling from where I sit is our own behaviors. We have the tools in our hands to fight and win this pandemic, but our behaviors have really fallen short of the spirit of multilateralism. So let's set the reset that button. At the same time, I think we must applaud the regional efforts, what I call regionalism, that has emerged from this crisis. The continent of Africa as a whole has struggled with this pandemic, but they have made use of their spirit of cooperation, the spirit of solidarity, the spirit of collaboration to fight this pandemic in a remarkable way. And I'm hope that when the history of this is written, that chapter will be remembered, that even though multilateralism fell short, in the spirit of which it was created, regionalism prevailed.
Let me ask you, Dr. Sridhar, to deal with the same question again and address some of those issues, because there are a couple of questions coming into the audience already are talking about what Dr. Nkengasong talked about, which is this sort of disappointing lack of trust that has emerged over the last 12, 18 months. Again, sort of the same question, is there a policy prescription here? Is there anything that the international community could have done, should be doing to, in some ways, sort of reduce the nationalism that has removed? And obviously, in the US, we were saddled, I guess is the word, with sort of Trumpism, which was already a very nationalist movement beforehand. But it wasn't just the US. We saw, Emmanuel Macron in France, who is one of the most leading internationalists, who also played in a little bit of vaccine nationalism in Europe and whatnot. Is there anything we could have done? Is there anything that should be done now to sort of get us back on the right path?
Well, I think what we've seen is a huge gap between the rhetoric before a vaccine became available. Think of the World Health Assembly in 2020, where leaders came together to say, even the Trump administration came together there to say, we're going to share products, we're going to do this properly, the promise of COVAX. And then actually what played out, which was rich countries acquiring the bulk of the doses, making sure they had preferential access to supply, and basically letting go of what their promises were. And while they pledged money, they didn't actually pledge doses. And you could hear from many leaders across the world saying, what use is money if you can't buy actually the good that you need to save lives, which is vaccines? I guess I'm a little bit more cynical, because we've seen this time and time again in the international community. Think of swine flu, the exact same thing happened with vaccines. Think of Ebola in 2014, when there was this chase for a cure in ZMapp or ZMatt. Again, who got it? It was certain countries which could have access to them. So I think for me, this really is a telling moment that we have to move away from the charity model of saying, please, can you donate doses? And out of your goodwill, give them. No, that model doesn't work. I think it's clearly failed. What we need is actually African countries given the capacity to manufacture their own doses. We've heard about regional manufacturing hubs, having emergency IP transfer in these kind of situations where people's lives are at stake. We've seen that happen before with the HIV pandemic, as well as, financing from the World Bank to be able to, now they're helping countries acquire doses, but build up the manufacturing capacity to produce them. So I think right now, if we look towards the next pandemic, because this one is already raging, the real lesson for me is how do we build up those regional hubs? Because the bottleneck here is supply. The scientific process raced ahead. Scientists did this in record time, and we got the technologies and we got an effective and safe vaccine. Hesitancy, funnily enough, in those areas which have been hit hard, the States is a different situation, but look at Britain, across Europe, across countries, people want vaccines. They ran towards the vaccines, at least here in Britain. So the issue has been supply, enough doses, and that's what we need to be working on, is away from the charity model of please donate. Rich countries will never donate. I'm living in one and watching boosters debates when they have to take care of their own populations. So we have to move away so every country can take care of themselves, and they have the ability to through looking at the infrastructure.
Debbie, can I push you on this? Because debate, particularly on IP transfer and manufacturing capacity, has been something that's been debated, in the international community for several months now. And the pushback you hear frequently from the private sector in particular is the traditional one. If you sort of take away our IP, you're going to get rid of the incentive for me to actually, make these things. But the other point, which I thought was more convincing, is it actually is not a manufacturing issue, that they're at capacity right now because the raw materials to come into the system are just limited. And that even if you sort of gave away our IP and suddenly magically built a a new factory in the developing world, there's just a limited amount of raw materials to develop these vaccines out there, and that's not going to actually provide a solution to the current crisis, or even frankly to future crises. How would you respond to those comments from the private sector?
The first one on profit, like, of course, the private sector is in this for profit and there has to be enough incentive, but I think we need to have a debate over how much is enough profit. I mean, the companies have done pretty well and they're going to be doing well for years because of boosters. So I think there is a question, at what point do you say you have recouped your investment? Far beyond that, at this point, at what point does it tip over to actually being able to produce this generically can actually save lives? And I think that's just a debate we've never had. The idea of when have shareholders made enough to recoup and beyond that. And we have seen, look at Moderna stock, Pfizer stock, they've done very, very well out of this. So I think that's a tipping point, and that's a debate that also happened with HIV and ARVs and getting them out to actually save lives. On the second one is a tricky one. Yes, I mean, it's more complicated than right now. I mean, I've heard this said, if we had IP transfer still, it wouldn't result in an extra dose. I don't know if that's necessarily true, because we have seen actually manufacturing up and going in India through, Sinovac and Sinopharm and so on. So there have been attempts to do it. But of course, we have to look at the whole chain from raw materials and onwards. The main issue seems to be the issue around a business model, right? You don't want to keep factories up and running if there's no market, right? So that's been the problem, because you don't know what the next pandemic's going to be and when they're going to be used. And here's some of the discussions I've heard is, for example, Dr. Nkengasong will know better than me, but it seems like, for example, even seasonal flu manufacturing isn't done on the continent. It's done in certain hubs. So actually, do we need to thinking about having manufacturing for seasonal illnesses that can quickly switch to pandemic illnesses, so that actually there's some way to maintain them? So there are tricky issues. There's no simple way, but I think just saying, okay, we're all going to pledge that we're going to share, we know how it's going to play out. They're not going to share when it comes time to do it. And now it's, we're seeing it now in the debate over boosters, which is a really tricky one, at least in my view as a scientist, because you're getting asked, should we be giving boosters? And in my mind, there's two separate questions, which is, scientifically, is there a boosted immune response from a third dose for vulnerable individuals, which is a scientific question, and it's an immunological question. And the second is it ethical to be giving this to individuals when there are those in the world who haven't even gotten one dose, health workers and elderly? They're two separate debates, and it's very tricky because they keep getting conflated currently. And that's kind of part of the mess where I'm like, well, actually, we can't rely on the charity model because it's breaking down.
Alaa, before I get to you, I have two quick admin things. One, we're getting questions fast and furious. If you don't know how to do the Q&A, it should be on the right of your screen in the chat section. So please use that. The other thing is, it's not your computer. We've been having video problems at the start. So I think we're back up and running. Everyone heard us. I think they were just not seeing us well, but hopefully we're back up and running. Alaa, let me ask you to sort of grapple with that, because I've been struck, and you've done a lot of work on this in sort of the geopolitics of this, and ask you, I guess maybe an unanswerable question, but I'll try anyway. This pandemic arrived at a moment when the tensions, sort of great power tensions, were almost at their peak. I mean, you did have Trumpism here in the U.S. You had Xi Jinping, who is sort of unleashed it's his own sort of unique kind of Chinese nationalism in Beijing, where they were incredibly obfuscating on origins and allowing the WHO to investigate. Obviously, Putinism in Russia. Was it just bad timing to have an outbreak, or do you agree with Devi that there's just something fundamentally nationalistic about our pandemic response, and therefore we have to stop thinking of the system as we've now built it and try to be a little bit more cynical and pragmatic about it? Alaa, you're on mute. If you can just.
My apologies. I actually agree with both John and Devi. There is never good timing for a pandemic. There's never good geopolitical timing, but to be very frank, our response for any security threat is always nationalistic. I mean, even when we do create alliances, even when we create multilateral institutions, they are to benefit our national interests. We can't kind of assume we're being altruistic about it, right? The difference with the pandemic is suddenly the security threat is something that we rely on each other to actually resolve. It's fundamentally different. We can't build up our own army to be the strongest. We can't sit down and negotiate with the disease. That's just not how it works. It can come through airports. It is unlike any other security threat we've had. And I would argue it's not just our geopolitical and our multilateral system that we're ill-equipped, or our vaccine production and our private-public partnerships. It's the way we do politics fundamentally. It's the same, and the best challenge, I'm glad the climate change panel was before us, a challenge that mirrors this is climate change. It's this recognition that the way in which we look at power on a political level has to shift when we have security threats that fundamentally are uncontrollable by one single nation. Now, to piggyback on the last question, I do think one of the solutions here is John leaned into regionalism a little bit. And Devi was kind of implying it. And I think that's actually a critical point to center here. We don't have global solutions. In fact, the second, and this has been my experience with global security as a whole, when we start talking about global solutions, usually they're great ideas, but when we want to implement them, we need people on the ground, we need people regionally, we need people locally. And if we're talking about really looking at how we renegotiate that conversation with private companies, if we're talking about looking at local production, et cetera, what we really need is some way to work with one another to create transparent global production planning. We need regulatory coordination. We do need that sharing of vaccine doses. Yes, governments will not, the charity model doesn't work, but we need stopgap measures in the meantime, because there is such an inequality that is beginning to happen across vaccine allocation right now. So even if it was some sort of global dashboard where you could see that production and availability, where you could work together across borders to remove any barriers, any logistical barriers, I do think that's critical. But it begs the question of the long term, because it does look like COVID will become endemic. And that long-term question, I think, is one that does sit at a regional and national level a lot more. We do need to ensure that countries have the agency to respond to pandemics locally. And this is, whether we want to talk about it or not, at the end of the day, this is not about IP or production power, et cetera. This is fundamentally about power. It is not a global health issue. It is a global power conversation. How much are we willing to allow, and especially in the way in which we do politics, how much are we willing to permit one another to create different avenues of power? That's what this is.
John, can I ask you to address that? Because it is, the issue of agency is directly tied to the ability to manufacture. How critical do you think it is for Africa in particular to develop its own manufacturing capacity on vaccines? But since you've done a lot of work with the WHO, I wonder if you could address that as well, because there obviously was, just for political reasons, a lot of rhetoric coming out of Washington when Trump was president about the big bad WHO. But there even some less, shall we say, partisan critics have been very, very critical of how the WHO dealt with the early stages of the pandemic, how they've dealt with China on this. Is there a need for again, trying to put Trump aside, is there actually a need for some reform of the WHO and the international level? Or is this something that you also agree that everyone's getting a little bit cynical here, and we need sort of more pragmatic regional solutions to tackle the next pandemic, or even the COVID phase 3.0, or whatever the next phase is?
No, thank you, Peter. Let me again just continue where Alaa ended, I think, which she touched on very key points, as well as what Sridhar mentioned earlier. I think we need to take our overall health security apparatus that was put in place in the mid-1940s, precisely around 1947. Look at it in the eyes and ask yourself the question if that is still the right security apparatus for the world, health security apparatus for the world. I can imagine easily, very crudely, that a house that I built about 75 years ago is no longer the house that I need today, or a road that I built 75 years ago definitely needs to be repaired. And that is not, when I say this, people hear different things. But what I'm saying clearly is that the health security apparatus of the world was set up in a way that regions like where I sit had to depend on there was dependency on others for your own security, and it cannot. A people of 1.3 billion cannot continue to be the moral scar in people's moral conscience when a pandemic happens. The HIV, I was in Cote d'Ivoire working for the US CDC when ARV drugs were available. It took 10 years before they got widely used in Africa. 10 million Africans died. have we forgotten about that? Memory is very short. I mean, people don't even talk about it, but which was, to me, they died unnecessarily. And I think Devi or Alaa mentioned the swine flu of 2009. So we've seen this over and over. Our behavior during this pandemic has been really nothing that we should be proud of. Okay, because we have the tools. I mean, it was true for diagnostics when we just started. Remember, the far cry was Africa needs diagnostics. I wrote several commentaries there, including in Nature, worldviews about let Africa into the diagnostic market. Nothing. Okay, but we're fighting a pandemic. Then vaccine, we started warning last year, even before vaccine were available. And I think as Devi mentioned, we said all the right things in the pulpit. Everybody said the right thing. Timely access, equity, and everybody. When the vaccines became available, we folded inward and took care of our own selves, not knowing that, I mean, that is not the solution for a pandemic. And this virus is challenging us in a way that, and I agree, we are heading towards endemicity. Let us just be courageous and admit that. I mean, our only failure would truly be the failure to admit that we have failed collectively, and we are heading towards endemicity. See what happens in Israel. Israel was hailed as a country that vaccinated very quickly, and we're all happy. The United States have moved forward, but see what is happening there. Variants came in and challenged that, and now we're rushing back to the drawing board and without science saying we need boosters. Let's just boost our way. So we are dealing with about 6 different kinds of vaccines out there. Since when have we seen the evidence that this immunity wanes similarly across all 6 vaccines we are using? We don't know that. We don't know that. Where is the evidence to show that if your immunity, your neutralizing antibodies go below a certain level, you are more at risk to progress to disease, severe disease, and hospitalization? We don't know. If we boost now, I mean, I got my last dose of vaccines in March. And so should I get one now? And then afterward, how soon should I get another one? We don't know. So we are just, we rush into this just because, again, we've refused to modify our behaviors, to adapt our responses to the reality of time, and to say that we are so much blessed that we are fighting a pandemic 100 years later compared to 1918 with a lot of tools. Those who fought and won the pandemic in 1918 had none of the tools that we had. They actually knew what they were dealing with after the pandemic was over. Okay, but they were successful. They were brave. They were resilient. I'm sure they worked together. We have the tools, but our behaviors have just completely been nothing that we should be proud of. So I think I agree that a couple of things. As a continent, I speak from where I sit, we need an entire new public health order and be very bold and unapologetic about that, which says we have to manufacture vaccines, diagnostics, and therapeutics. We have to strengthen our own institutions, public health institutions, including regional bodies like the Africa CDC, that the head of states believe in now completely. I've had the chance to brief them about 16 times since this pandemic. I mean, that is remarkable for the region. We need to make sure that we develop our own workforce capacity, capital, so that you can co-create intellectual property. I hear the discussion about transfer of technology. My worry is that it creates another stigma that it says that our young people should fold their hands and wait for technology to be developed in China, India, or United States, and then transfer it to us. That is not what the conversation that we should be having. Again, when the current health security architectures were put in place, as a continent, we were about 300 million people as a continent. Today, we are 1.4 billion, heading to 2.4 billion in the next 30 years. So young people, let's put in place as a continent our demographic dividends and make them do the research, develop property, and begin to it. That doesn't solve the problem today, but it should solve the problem for tomorrow.
John, can I push you on that? Because I know you might have to leave to catch a flight, but just to push you on this, because up until the pandemic, Africa was almost one of the few good news stories globally, in that Millennial Development Goals. I mean, we started to hear that capacity building in Africa was starting to reach the point that we had all hoped it would, and that there was the self-sustaining and whatnot. And there is a lot of concern. I've heard this from the Rockefeller Foundation and others who have said, boy, this has been a setback. I mean, we have gone back to almost pre-millennial development levels. and it's getting worse because the developed world is vaccinated and the economies are booming. How concerned are you? I mean, you were sort of admonishing the young people of a continent of almost 2 billion people to sort of look inwardly. But are you worried at all that this pandemic in particular will set back capacity to actually deal with it, Africa, deal with it on its own?
No, absolutely. No doubt about that. Again, I've said many times that this is a generational issue. We refer for generations and generations to come. There are whole segments of young people that are not going to school because of this pandemic, disrupting education. Education is the foundation of everything else that we are discussing here. Whether we have good epidemiologists, good researchers, and whatever, it's all about the foundation is the good education there. It is setting back tremendously our economy. Each time we see these waves, I mean, Africa is going through the third wave. I think a few countries are now going through the fourth wave. The impact on the economy is huge. And you cannot rebuild back better, bigger and bolder with a weak economy. And we are going to see that. We are beginning to see national security threats from this pandemic. I mean, the national security threat, I underline the word national security threat from this pandemic. So the continent is, and don't forget that the endemic diseases have not gone away. The HIV, the TB, the malaria, that we were on a very nice trajectory and now will come back and strongly. Testing has fallen by 40% for some of these diseases. And I think that is the big challenge. So we are really in for a long haul. I said at the start of this pandemic that this is an existential crisis for the continent, and it's almost 18 months into it. I still believe strongly that it is, and especially given the nature of how this virus is evolving. We started off believing that with vaccines, we'll probably get to 60% immunization and create herd immunity. Gone. Throw it out of the window. Not going to do that. Now, our strategy has to be, how do you vaccinate everybody? Because the vaccine now, we are using it now as semi-therapy, okay, which means it's, if John or Devi are healthy, you get your vaccine with the hope that when you get infected, your severity of the disease will be less and you will not go to the hospital. So that is now using it as semi-therapy, not trying to prevent a transmission of the virus. We now know that even with the vaccine, you can be infected and you can transmit, and that you'll be sick and whoever is receiving. So that has to change, which means that instead of thinking of vaccinating 50% to create barrier, we're doing this for a long time. And we are 3.5% fully vaccination. That is why I said that there's absolutely no way that we should not be thinking of this as an acute pandemic. I mean, the acute phase is gone. I mean, as Africa, I will be advising the continent to put this into your long-term strategy of herd defenses and respond for the continent together with the other challenges.
3.5%. It's worth remembering that. Devi, let me turn to you because you very helpfully helped us frame the conversation in your first remarks. But if I could just push you again on this issue that I talked to John about, which is if we are agreeing that the solution has to be more regional and less sort of Bretton Woods 1940s international, what do you do about the fact that we are sliding backwards in the developing world over the last 2 years during the pandemic in capacity building? How do you address that? Because if your solutions are regional manufacturing hubs and transfer IP at a time where suddenly, as John said, Africa and other developing regions are losing and falling back in education, falling back on some of these other development goals. How do you match that? And is there a way to deal with that?
I mean, it's hard to have an easy solution to this. This is a massive problem. And as John has said, I mean, look at even where we are in Scotland, and you vaccinate over 90% of your population and you're still having transmission and you're still having hospitals filling up with the people who are unvaccinated because this virus just seems to jump and cause such high levels of hospitalization that even in this context is difficult. And then you think of going into a low-income context where you only have 3.5% coverage, much less health resources, and then the issue of schools closures and all the rest of it. I think it's exactly right. I mean, there was a hope with Israel when we saw those rates and numbers coming down and they had 0 cases that we could reach some idea of herd immunity, a threshold where we could stop circulation of the virus. And that provided hope because you could say there's a way through this, given how we've managed measles, given how we've managed other diseases. where I think now we're looking at this as a chronic issue that we're going to be living with. And the hope is that we don't see a more difficult variant than Delta. I mean, Delta is pretty horrific. I don't think any of us anticipated that we would have a virus become more than two times more transmissible within the course of 18 months. And it has gone into countries, I'm thinking of even Senegal, which did so well in its first wave, but how do you deal with a virus that keeps coming back in a form that's more and more challenging to suppress, and the tools you used before don't use again? So I think, again, as you know, I can't add much more there, but working with institutions like the World Bank that can provide comprehensive financial packages and saying, look at holistically, you know, across the spectrum of health, how do we keep our measles vaccination campaigns going? How do we keep schools moving? How do we make sure we don't slide behind on polio, which is now showing a resurgence? How do we keep going with those other agendas and manage COVID as best we can, though it's, given that it's unlikely to be something where you could just throw everything at it and it goes away. It's going to be here for a while, and it's going to be causing huge devastation. I guess my one plea would be around schools, where I think across the world, we saw school closures and, you know, schools shut. I mean, I was just listening to a meeting in Kerala in India where schools have been shut for almost 18 months. Can you imagine kids and not in-person learning? And I know in the United States, kids have been out of school as well, depending on what state you're in, or in Zoom school. Big problem for kids who don't have Wi-Fi. We need to get schools back into in-person learning and figure out how we get back to kind of the basic building blocks of building our society: education, jobs, development, while managing COVID at the same time. And it's a tricky one, but I think we have to move beyond blanket shutdowns and lockdowns, because we can't do that indefinitely now. We have to use vaccines and therapeutics to find our way through.
Well, as the father of 2 young children, I say amen to that. Alaa, I'm going to give you, we're running out of time here. I want to give you sort of almost the last word here as sort of the representative of the UN, the head of UNGA, because I worry slightly this conversation has focused a lot on regional solutions, and I want to take it back to the international community, because obviously that's what the UN is. Can you address, I mean, both John in particular has talked about revamping sort of our Bretton Woods 1940s era way we approach these things. Just to tackle that, but also sort of, can you address where you think, if we were to, you know, we have 6 months from now, we would gather this group back together, what would you like to see the international community do in the next 6 months? What is the role for the international community if we take Devi's solutions to heart, which is we need it to be more practical and more regional? What then becomes the role for the WHO and the UN and the international community?
No, I hear you. So I don't think it's an either or in terms of regional or global. I think it's a both and. I do think multilateral institutions are critical to creating that clarity and urgency, but also coordination. I think that the issue becomes when we anticipate that the global community is going to prioritize global interests over national interests. That I don't think is realistic. What I do think is realistic is that we can coordinate national interests across the world. And so having things like, you know, envoys for COVID, having clarity and sharing around, you know, different vaccine production, distribution, working with each other to reduce a lot of those barriers, you know, I think that's very critical in the short and in the long term, to be frank. It does shift us away from looking at the multilateral institutions like the WHO and the UN as the solution bearers, and rather people who can bring together those leading in their respective regions and continents, like John, to the table saying, okay, what's working for you, what isn't working for you, so that there is more of that sharing and partnership. I do think that's a critical role for the multilateral institutions. The other thing I'll add on, and Devi mentioned the World Bank in terms of financing. I think financing vaccines is critical. It's hypercritical. I also think we need to recognize the impact. I mean, we talk a lot about supply chains when it comes to private businesses and you know, things like car manufacturing and computers and how they've been hit by COVID. But the supply chain, when it comes to a human level, when we're talking about things like, you know, increased misinformation and disinformation, when we're talking about a huge reduction in women's rights and girls' education, when we're looking at economic plummets, what we're talking about as a whole is an increased likelihood of internal and regional conflict. And we need to ensure that our multilateral systems, which have really been critical in maintaining regional stability and global stability in the past, not always at 100%, but have been critical partners, really need to be prepared for the aftermath of COVID while COVID still exists. We all talk about a post-COVID world. That's not going to happen. So how can we start working on those parallel impacts? How do we work on girls' education? How do we work on women's rights? How do we work on economic fallout while still battling the pandemic itself. And I think there is definitely a regional, national, and global play there where we can start looking at that pie and say, this is way too overwhelming and big for any one country, anyone, the African Union alone, Senegal alone will not be able to do this. How do we do this collectively? Who addresses which piece of that pie is pretty critical. But I think that impact on a human level is somewhere where the UN is going to have to come in, along with other multilateral partners, quite strongly.
And it's going to have to take coordination. Can I ask just one question on this? Because, it's been a theme that's run through this conversation, and the question just popped up in my inbox, which is the trust deficit. And I come from a more traditional national security background when I was a reporter, and there were always these phrases about trust building exercises where the Israelis and the Palestinians or other organizations, when they talk about peace deals, there is sort of these slowly step. Is that something we need now? I mean, the bad blood seems to be so bad right now amongst some of the major players. Again, the U.S.-China thing is the most obvious, but I don't think it's just U.S.-China. Is to get to where you're advocating, which is coordination on an international level, but also a role for regional and national. Do we need something soon where we start doing a little bit of trust rebuilding? And if so, I don't know how do you think we could do that?
So my very oversimplified answer for you is yes. Ask me about execution and implementation, and we can't really move farther unless we have the people in those rooms. The reason I say yes, though, is because we're at a point where, you mentioned Israel and Palestine. That's an excellent example of where who are the stakeholders in this conversation. With this pandemic, we're at a fundamentally different point. Everybody's a stakeholder. Anybody with a cell phone is a stakeholder. Governments are, private companies are, and there is such little clarity around what is actually correct. John and Devi both kind of delved into the debate around boosters. Overnight, news stations and politicians were talking about boosters, and a lot of doctors and scientists were like, wait a second, what? We haven't actually assessed if this is necessary, but that became the topic of conversation. And so I do think, I think there's a need to really look at how we build trust, but also, quite frankly, what are we doing about the information that is out there? And how can we regulate information, or at least create greater clarity around what is legitimate and what is not? And that is, as somebody mentioned, the 1918 flu. That's one of, I think, the biggest and most critical differences, very frankly. Yes, we're scientifically much more advanced, but my goodness, we can communicate, and everybody has, the ability to have a platform. And that has, I think, spurned a lot of the challenges in terms of, in the US and in many other countries, a lot of the challenges around, do we prioritize a global engagement before we look at our own national interests? Do we actually, donate vaccines, or do we fully finance vaccines? A lot of these conversations have a hint, and not just a hint, have a strong dose of misinformation attached where people don't necessarily know. And I think that's a thing we need to address.
It's amazing to me. Here we are 18 months, almost 2 years into this, and yet still the science seems to be trumped by the politics. And I don't even mean disinformation, because the debate about boosters is being promulgated by rather mainstream politicians, and the scientists are quite grumpy about this.
But that's something that we've seen across global security historically, right?
Fair point.
Trumped by the politics. I think why it's so critically different here is because the facts here are what actually make up life and death. You can't build up a military, and we go, even in this conversation, we go straight to production because that's what we know. Right? We're like, okay, well, how do we build up our infrastructure? How can we actually build up our army against this? When the reality is, let's say we build those manufacturing plants, we share IP, et cetera. We're still going to be probably in a very similar position as we are in today, because it's that human nature component that we are not addressing.
On that optimistic note, I'm getting the hook from our organizers. Thank you very much to the panel for this really, really stimulating, if somewhat depressing, discussion about tackling COVID and the pandemic, and hopefully this time next year, when UNGA meets again, we'll be all in person and we'll be not dealing with another variant. I'm going to pass it over to my good friend and the host of this entire event, Ed Luce, who is our national editor based in Washington, for a panel to wrap this all together, try to figure out how climate and COVID and the other international crises we're facing, how the international community can get together next week and solve all of them. I'm sure it'll be a very easy one. Thank you very much for joining us.